This is a demonstration and review of hip precautions. We're going to demonstrate some bed mobility and then how to get on and off a commode, in and out of a chair, following proper hip precautions. And this is specifically for posterior approach hip arthroplasty. Our patient here had a left hip replacement. There's three basic precautions. The first one is we cannot let the patient go past a 90-degree angle here at the hip. The second one, you cannot let the hip internally rotate. So that would be kind of pointing your toes inward. The third one was we can't let this left leg cross the midline of the body. So we're going to demonstrate how to get a patient out of the bed following these precautions. Most of the guidance is going to be by the therapist is going to be using the left leg. The patient is going to be instructed to purposely use their arms to brace themselves as they kind of lean back, scooting their bottom out towards the edge of the bed, and also using the right leg to lift their bottom as they come out towards the edge of the bed. The assistant should be guiding the left leg for pain and also to follow these precautions. So we don't let the leg cross the midline of the body, and we don't let the patient lean forward. So we want them leaning back as much as they can. Okay, and we want them to come all the way out until they can get their leg safely on the ground. Again, not letting any rotation and not letting them bend forward at all. Raising up from the bed, we want to make sure that the bed's at the appropriate height. So the higher the bed, the easier it is for them to get out. So this is our patient's first time getting up, so we're going to raise it up a little bit. Place a gate belt on for safety. Assisting a patient up to their walker to a standing position, we're going to instruct them to keep their leg out. That reduces the angle here at the hip. And we're also going to instruct them to kind of come straight up with their body as opposed to leaning forward. Okay, and once they stand up, we just make sure the left hip is in the appropriate position, and we'll assist with that if needed. Next, we'll demonstrate proper technique for having a patient sit down into a chair. Okay, just as when they stood up, they should have their left leg out to reduce the angle at the hip. So you need to instruct that and also assist with that if needed. And then again, not letting the patient lean forward. So we're going to instruct them to kind of keep a backward lean as they go down to the chair and reaching back for the arms of the chair, keeping that left leg out and going down slowly. Standing up from the chair is the same as coming up from the bed, so we'll just repeat the procedure. Left leg out to reduce that hip angle. Patient should stay kind of in a backwards lean. Okay, and then we're going to demonstrate how to get on and off a commode. And again, it's the same procedure as sitting in a chair or sitting in a bed. We want to bring the left leg out, and then the patient's instructed to reach back for the commode. Keep that posture. Down nice and easy. We have to use an elevated seat so they reduce that angle here, and as they're on the commode they should stay leaning back and that leg should stay out. Okay, and then getting off the commode, and again we'll make sure they're not leaning forward as they slide out, keeping that left leg out Standing up by pushing off the arms of the commode and back to the walker.